Okay, here we go, Jet. It's so good to have you back for our final panel discussion of the day. I hope you've enjoyed the conference so far and have gained a lot from it for your use, but also to share with colleagues. In this panel, we'll be discussing digital tools that can be used for better procurement, and it's in partnership with AutoGen AI. Understanding what data is available and how to use it effectively will ultimately enable NHS buyers to make confident, informed decisions. As we know, procurement in the NHS has a higher degree of transparency and compliance requirements, so we can build digital tools that enable procurement professionals to make faster decisions and work across a wider area, whilst remaining confident that they're meeting their legal obligations and delivering the best value for providers and the best care to patients. So let me introduce you to Sean Williams, founder and CEO of AutoGen AI, Steve Balding, Commercial System and Data Strategy Program Manager at the Department of Health and Social Care, Niels van der Winkel, Head of Procurement Data, NHS England and Improvement, and Hatim Abdul Hussein, National Clinical Lead for AI and Digital Workforce, NHS England. This is your last chance to get any questions you may have across to our panellists. I'm sure they'd love to hear from you, so just make sure that you use the little Q&A function, which I think you'll find on the right-hand side of your screen. So I have to put my glasses on these days to actually see if I've got any panellists there, and it looks like we've got a full house. So welcome to you, gents. Sean, let's kick off with you, if we may. Tell us a bit about what AutoGen AI does.
So we're using generative artificial intelligence, large language models, this brand new type of artificial intelligence to help organisations bid for write tenders, proposals, professional business pros faster, more efficiently and more effectively. So hoping to level the playing field so that suppliers providing services to public and indeed other private organisations are able to get their messages about what they can deliver and what they can do across more efficiently and more effectively, and hopefully bring down the costs of competition for the procurers and the suppliers, allowing more money to go into frontline services.
AI, I think, Sean, is high in many people's minds. There's a bit of nervousness around it and skepticism and excitement. To sell it to us, what does it mean for procurement?
Yeah, I think you've hit the nail on the head then with sort of nervousness and skepticism. And I say kind of with any sort of new technology, it starts off with it's going to kill us all. Then it goes to it's going to steal all our jobs. Then it goes to what was this technology about anyway? It's not going to do any change. And then we sort of come to see it as a tool. I can tell you why I think AI has suddenly become very big, and it's this new generative artificial intelligence. So the technologies that change the world are the ones that take a fundamentally human activity and make it orders of magnitude faster. So if you take the abacus, 2700 BCE, it makes adding up and multiplication a lot quicker. Well, so what? Well, that allows you to trade quicker, and it allows you to trade more in more complex terms. And it turns out that trading, buying and selling things is fundamentally human. If you go to the steam engine speeds up the manufacture of goods. The printing press speeds up the sharing of ideas. The internet speeds up the sharing of ideas. And now this new generative artificial intelligence, which has been around really for the past 24 months, it speeds up the creation of content. We're really used to computers being able to add up and multiply faster than us. We're not used to them being able to read and write faster than us, but now they can. And that's going to change the whole world. And in particular, in this space, it will clearly have a huge impact on procurement.
That's actually a very good way using the abacus of explaining it. Thank you for that. Steve, you were smiling away there as Sean was giving his opening. Are you embracing AI at the department too? Oh, Steve's dropped
Sorry,
off
just
there.
about. I'm muted rather than unmute, so sorry about that.
I thought you didn't like the question, so you'd taken yourself off the panel.
So my role is about introducing basically procurement technology that helps us bring data together and improve data across the NHS in the past. Lots of different tendering systems, lots of contract management systems, lots of Excel spreadsheets. And what I've been doing is working with all of those organizations to try and put the information into ways of operating together. It makes it easy as contract managers to collaborate together if we can see all the contracts in one place, we can then see the whole picture for a supplier in one place. So what I'd suggest for us where we are right now is we're preparing the ground for robotic process automation, for AI, as that follows in the future. So the things that Sean is saying is absolutely fantastic, because what we can do then is we've got good data sets. We can then start to analyze that, use the AI to say, this is how we can generate savings. This is how we can mitigate supplier risk. So that's, a sum up from me. My thoughts on where we are today.
Fantastic. Hatim, is the NHS ready to procure new AI solutions, do you think?
So there's various aspects there that you need to consider, and apologies for any background noise. The first thing is the workforce ready to be able to use it, and is the workforce ready to be able to do the procurement process, because there are lots of challenges to overcome. We did a piece of research last year at NHS England that showed us what AI technologies currently exist within the NHS, and of those technologies, which of those will be close to deployment in the next 5 years. And we found technologies that affect automation of service efficiency type tools or administrative type tools are probably a good place to start, because one, there's a group of technologies already in this area, and two, it's not directly involving patient care, so it's a bit more frictionless, I would describe, but despite of course some complexities. But the reality is that all of these will need to be evaluated, and to be able to scale these types of technologies, we need to make sure we get evidence. Do they bring a return on investment? Do they actually make the pathway quicker? Do they actually free up time so people can be augmented to be doing other things? The other question around that then is, the workforce ready to use AI as a tool? And that's hard, because we know that 25% of the workforce actually have quite low digital capability. So we have to bring up digital literacy and capability up along for those individuals. But there are a group of the workforce that actually have a level of capability that would be able to use these tools. And what we need to do is then have the right education that allows them to understand the technology and how it fits into the way they work and how they might use it in their practice. And I think having some real case studies in this space will mean a lot. So at the Digital Academy, we're doing that work to start to create learning in this space, but then demonstrate case studies where it can be used in reality to help build up that knowledge and skills.
Fantastic. Nils, good to have you in the conversation. Before I ask you a question, did you want to add to anything that's already been said there?
I mean, it's such an exciting topic. Could talk about that just for the next 30 minutes. Yeah, I'd love to. But I think what Sean was mentioning there, there's a lot of potential benefits for suppliers in terms of using generative AI, large language models, in the procurement process. However, and that might have efficiencies, the cost to serve can go down. However, for a procurement professional, there is also an increased requirement then to be able to understand, as part of the evaluation, what content suppliers are supplying us. And I don't want to say, to make sure that they properly validate and vet the content that is being submitted, because as some examples have shown us, services such as ChatGPT, other large language models as well, they have the ability to carry on a conversation in a generative capacity, which may or may not really be based on facts. And I think that really is key for a procurement professional to be able to evaluate a supplier response to requirements that we have set out to ensure that the best value and accurate supplier capabilities are being tested as part of the procurement process. So completely echo with what Hatim was saying around, we need to make sure that our workforce, procurement professionals, are understanding of what generative AI is as a technology, how they can apply it in their roles, but also how they might need to be able to distinguish what is content that was created through AI.
So to sum up, what do you see then as the foundations that we need to adhere to for achieving valuable insight and effective procurement outcomes, Nils?
Very much echoing what Steve was saying, I think a lot of the ability of a procurement function to create valuable insights into where opportunities might be in order to improve efficiency, in order to deliver savings. In a lot of cases, it comes down to the basics. Do we have the right data at our fingertips? Is that data well structured? Is that data well maintained and accurate? So do we understand the basics? Do we know what are all of our contracts that we currently have active? Do we know all of the contracts that we need to re-procure in the next 18 months or so? If we have those basics in place, clear standard processes that every member of our procurement team follows and is aware of. That is the basics to getting a rich data set, and that rich data set can then be used for analytical purposes. And unstructured data, such as signed PDF contract documents that used to live in people's drawers spread over different buildings across the country, thankfully now are in Atomis for a large part. So for all of those organizations that have onboarded to Atomis, we now have a single source to contract system across the NHS. And that means that we've got more and more of a structured data set in Atomis, but also all of these additional data attributes or data files that could be used potentially in the future for some very exciting analytical use cases.
What has changed, Sean, in AI that makes it now suitable for responding to bids, tenders, and proposals?
Yeah, so 3 things really changed. So in 2017, a group of primarily Google engineers released a paper called Attention is All You Need, which suggested a new neural net architecture. So if you think of these big silicon brains, they essentially suggested a new way of those big silicon brains functioning. And then those big silicon brains got bigger. So they're orders of magnitude bigger than they were 3 or 4 years ago, 1,000, 10,000 times bigger. The latest models, GPT-4, are to say Elmo a few years ago, and they read more. So the new architectured big silicon brains have now read everything that's ever been written. So all of the digitized content, every book, everything on Wikipedia, the entirety of the internet. And it turns out that when you combine that larger training data set with a very large brain and with this new attention mechanism, this transformer architecture, it's what the T stands for in GPT and, for example, ChatGPT, it turns out then you have this emergent property that computers can now write and read and give the impression of understanding language and repurpose information and much like a junior researcher would, or a junior writer, read things for you and write for you. So that's what changed. We're right at the vanguard of that revolution. And it will undoubtedly, as I say, change the whole world and particularly kind of the procurement piece in that. And it brings up a whole host of challenges. So how do you exacerbate that problem of making sure what tenderers are saying are true? We use something called retrieval augmented generation. So we're always basing our content on factual previous content. But it's certainly true that large language models in general can hallucinate, can make things up. It clearly gives you the ability to much faster put information out there. So you need the corresponding then ability to be able to evaluate that information. And of course, on the procuring side of procurement, making sure that what people are telling you is true and is actually meeting your requirements. But I think large language models bring a huge opportunity to work on both sides. And eventually this technology will feel like Excel. Nobody says to a supplier, you're not allowed to use Excel in producing your financial model. Indeed, it would be silly to say don't use Excel when you're putting your financial model together, because your financial model will be worse. Now, of course, what Excel doesn't do for you is build you a financial model, but it does allow you to build your financial model far faster. It does allow your financial model to be far more sophisticated, and it does push humans up the cognitive hierarchy such that humans are actually doing really now high-level judgment work and are better able to put together a financial package for people buying services.
Just briefly, Sean, before I move on to Steve, but Nikos says, when do you think AI will become standard practice in procurement stroke business operations? Or is it for some?
I was going to say, I think in a lot of sectors, it simply already is. And I absolutely guarantee you that whatever the policies say kind of throughout the NHS, that you will already have hundreds, thousands of staff using large language models, using ChatGPT, using commercially available services. And of course, there's all sorts of data privacy issues there, all sorts of issues of sharing data. But when you've got a technology which is this powerful, which can make people's halve the amount of hours somebody has to do a task for, then people will be using this technology. So I think the honest answer is that it's already being used in every aspect. ChatGPT got to 1 million users in a few days. Kind of it took Netflix 3 years to get to that many users. So
Yeah.
this is a technology that's so powerful that it's spreading so quickly. I think that the challenge actually for organisations and institutions is to catch up and say we need to give our people ways to use this technology in a safe, regulated, supervised way, and to the point about training, to make sure that they really understand the power, the opportunities, and also potentially the pitfalls of any new technology.
Yeah. Steve, Sean mentioned Excel there. What advice would you give to an organisation that's using Excel to track and manage their commercial activity?
Yeah, so thanks, Alan. It's been a bugbear of mine for quite a long time that groups of buyers in organizations have a shared drive. They've got an Excel spreadsheet. It's got their pipeline in it of things they're going to buy in the future. It's got their active contract register, so their commitments to the market, etc. And people overwrite each other's data. The data is out of date. The Excel is not fit for purpose. We've seen things like NHS Test and Trace. The media coverage of Excel basically being broken by the size of the data. So I would really recommend that people invest in a fit for purpose system that will manage that as a really, really basic starting point. Try and get into things like SharePoint lists if you haven't got the budget to get into a proper system. But within the procurement contract management market, there are many different products out there that are good value, and they will immediately, if you're in the UK public sector, put you in a position where you're using a system that's using the standard fields, that's making you legislatively compliant, that's really helping you follow the direction of this is what we want to buy in the future, these are our active contracts. You can then get into good stuff, as Neil said, of integration to electronic contract signature systems such as DocuSign, Signable, that kind of things. You're getting all your contracts and attachments in the same system, and then that's moving you down the path to AI, where the AI can see and read through OCR, the contract KPIs, obligations, commitments, clauses, etc., and then you can start to really positively exploit that data.
Fantastic. And Niels, I'm sure you've got stuff to add there on what types of digital tools organizations and buyers could be focusing on in their own organizations.
Yeah, I mean, an extension to what Steve was saying, really, I think to some extent it really depends on the organization. It depends on the organization, it depends on their wider IT architecture, it depends on the budget that they have, and it depends on the operational needs or the legislative needs that they have. But I think there's always that need for an operational systemization, so operational processes. In order to standardize those, in order to systemize those, we have operational systems that help with that end-to-end process and that generate and capture a lot of data that can then be used for additional analytical purposes. So Atomis, the adoption of Atomis, a single e-commercial system across the health family, has been an example of a single system to systemize that end-to-end source-to-contract process across the health family. But then on top of that, I think there's definitely additional analytical capabilities or analytical systems that organizations can look at, can think about, and that can either be standalone systems or analytical solutions such as Microsoft Power BI infrastructure or Tableau, etc. And that's really if you have a lot of those data sets in those operational systems, pull those out in a data warehouse or data lake, and then visualizing those. And then there's the additional, I suppose, category of technologies, which to some extent might be, and this is what I'm sure where Sean will counter me, where I might say to some extent, I would focus first on the essential, focus on the analytical capabilities, and then focus on the, I'm going to say, dare I say, nice to have, but technologies or overlay technologies such as robotics process automation or large language models and generative AI. I think more and more we will see that those will be integrated into operational systems. For the time being, a lot of them are still standalone solutions, not discounting the value of them, but in a lot of cases, the application of RPA is only used, or in a lot of cases is used, where the underpinning operational system isn't as efficient as it could be or should be, or the wider IT infrastructure isn't integrated. So I think there's the different cascade, so to say, of essential operational systems, analytical suite, as well as then the additional overlay technologies to think about.
I'll let Sean jump in a minute, but Haseem, we haven't heard from you for a while. I was just wondering if you can talk about the risks, the risks with regards to data and bias for digital technologies.
Yeah, I mean, that's critical. We know that the underlying data can be really biased. So one of the things that we're looking at the Academic Health Science Network, we're at in Kent, Surrey, Sussex, is looking at what advice can we give when people are procuring AI to understand the underlying bias around data, particularly around gender bias, but also ethnicity bias. There are other automation biases, there are other biases that we may need to consider. And is there a framework that we can create that helps people when they're doing procurement to take these things into account, to make sure that it's the right tool to use? And also with Gen AI, I think we have to consider there are some risks that we're not even aware of, really. So we know that they hallucinate. We don't know how much they hallucinate. We also know that there's risks like data commingling, so they can pull data in from other areas. Now, you can mitigate for these, and there are some innovators doing some impressive work in this space. So it is something to look at, and I think we will be able to measure in the future. But we need to for me, it's important that we test these things out in a safe environment, maybe even with synthetic data first, and make sure that we have the right data that we need for the problem. And it was discussed earlier how validation is important. Validation, both external validation and internal validation, is essential to this.
Sean, I'm sure you're doing work in that arena, are you?
Yeah, look, I think the hallucination problem's incredibly important. When we first started looking at this about 15 months ago, people weren't calling it hallucination, so we came up with our own term. We internally call it the Boris Johnson problem, which is it's the language can sound plausible, it can be very grammatical and very persuasive, but it doesn't have any factual underpinning in reality, and that's the way large language models work. So large language models are randomly picking words based on preceding words. So the thing which always astonishes me about large language models is not that they ever lie, it's that they ever tell the truth, given their kind of underlying structure and how they work. So if you're just using a pure large language model for anything where truthfulness is incredibly important, for example, in procurement, but in obviously anything in the wider NHS, then using a large language model naively is not a good approach whatsoever. As I say, I think there's lots of interesting things being done. Again, we've been working on a body of work for about 12 months now of what's most recently started to be called retrieval augmented generation, where you use large language models' power to find information from trusted sources and then repurpose that information. So I'll give you an example of things you can do. Let's say you have a transcript of 10,000 nurses' conversations with 50,000 patients on a particular topic. You can then use the large language models to find the most semantically relevant new query, new question. You can then find all of the answers that have been given to those types of question before and repurpose those answers back for the new question that's been asked. And it turns out if you use that sort of approach, you get very, very high levels of accuracy, indeed probably higher levels of accuracy than you might get from a human doing the same thing. So it is a very new technology. It's a very new area that there are very legitimate concerns around hallucination, around bias. I mean, there's some amazing things you can do on bias just with the maths and the large language models. For example, you mentioned gender, where you have words which are traditionally gendered in the corpus. So as I say, these models have been trained on everything that's ever been written. So in everything that's ever been written, doctor is more associated with male words and nurse would be more associated with female words because of a biased data set that you're using. But you can actually just in the maths correct for that and say that doctor is a neutral word and take away actually all of the gender bias in it. And OpenAI and others have done some really interesting work in that space. So any technology that relies on data from the past is going to share the prejudices of the past. And then it's how you use that technology cleverly in the future to keep the insights that you can gain from obviously millions of data points while getting rid of the things about the past that you just don't want and wish weren't the case going forward.
It's fascinating, and it's fascinating to hear words like hallucination and things like that, things that to you are just the norm in the work you're doing, that presumably in a few years the rest of us will sort of catch up on all of that. I think we're always a bit nervous about anything new. I remember actually being taught to send my first email. I was in my 30s and I thought, why do I need to email? Like, we've got the Royal Mail, so I know that there's that sort of, from some people, they'll sort of glaze over with AI or feel nervous of it. But I think ignore it at your peril, really, because it has got the ability, I think, to bring some fantastic developments for us. Steve, you were talking about systems, and we're talking about Excel there, but how do you gain agreement from many organizations to try and use the same system set?
Yes. UK public sector and then into the NHS, we've got many organisations trying to do the same thing through a federated approach. We really want to try and do things once where it's practical. You get the economies of scale. I and Nils have been working on convincing, cajoling, encouraging, gaining advocacy for this. Let's put one system in once. Let's do things together. Let's build the best we can with the best value. So I think it really is a case of winning hearts and minds, proving ourselves through the results that we deliver, through the opportunities that we deliver, through the cost savings we're able to achieve. We've got some trusts and groups of trusts that are really just starting to find, through their own analysis, millions of pounds worth of savings by perhaps looking at specific categories of spend, laundry, clinical waste, that kind of thing. How can we put better value contracts in once, instead of having lots where we're paying a high price and a low price, etc. That kind of thing is really going to help us in the future. And I think if the AI can get us to this stage of presenting to the human, this is the opportunity. That's an exciting stage, because we're getting to a decision quicker. What then is going to scare me is when the AI looks at all of the data and we allow it to make the decision. So it makes the decision and it places the orders, and the goods arrive in the hospital, and the goods are better quality and better value. That's going to be the transformational stuff. Presenting data to humans is great. They make the decision. But when the AI is doing it, that's going to be the game changer.
Yeah, Hatim, you're nodding away there. Do you feel the same in terms of that being the game changer with all of this?
Yeah, no, I completely agree. I think that is key. I mean, I think this whole area is very complex, and it needs a cautious, sensible approach, and it needs to be evidence driven. And we need to look at existing pathways and transformation. It's good to see that infrastructure is in place that allows us perhaps to do it in a more effective way, and we now need to build on that and innovate. I mean, this is a perfect place to do that, so I'm quite excited.
Absolutely. And Hatim, is the development of secure data environments going to help the procurement of data-driven technology, do you think?
Sorry, did that come to me?
Yeah, please.
Yeah, look, I think the secure data environments are going to have a lot of opportunity for innovation. I'm currently working with Sussex and Kent and Medway as they build out theirs. And it's really exciting to think about some of the use cases that they're looking to perhaps apply to it. Clearly, there are lots of things to sort out there in terms of governance. And actually, how we work with what kind of partners we work with the secure data environments is going to be really key as part of that. So you could argue procurement is a key part of that conversation as well, in terms of who we work with, who will give access to that information, and what is the right level of data that you give for that type of innovative activity. And a lot of that work still needs to be done, but it makes a lot of sense because these secure data environments are still in that phase of building themselves out and working out their strategies.
Nils, what will the expectations of the new procurement regime be for procurement professionals in relation to publication of transparency notices, and how can we ensure that procurement professionals stay informed?
Yeah, so I think there will be quite some significant changes that will be coming up for the procurement community, all as part of the procurement rules reform that the UK government and Cabinet Office are driving through. As part of that, there is a large focus on the transparency ambition that is set out and is publicly available. That is a really ambitious program of work, and for procurement professionals, there will really be an additional need to some extent to really think about what aspects of the procurement will need to be published and at what stage. And I think, again, there will be technology to help professionals in this work.
And